Okay, let's unpack this. Welcome to the deep dive. This is where we take your notes, your sources, and really get into them to pull out the highest yield stuff.
Exactly. Think of it as us helping you get straight to the point, especially if you're revising.
And today, we're looking at a specific set of notes someone sent in, all focused on viral labyrinthitis.
Yeah, really useful notes. So our goal here is to work through your material, listener, pull out the absolute must-know details for revision, and, highlight what's really key from these notes.
Absolutely. We want to make this stick. We'll cover the definition, causes, symptoms, how it's diagnosed, managed, prognosis, the whole lot based on what's in front of us.
And we'll flag those memory tips and high-yield facts as we go. Ready to jump in?
Let's do it. So starting right at the top, definition. What is viral labyrinthitis, according to these notes?
Okay, so the notes define it clearly. It's an inflammation of the inner ear, specifically the labyrinth.
Right.
And the cause, well, it's in the name of viral infection.
And that inflammation in the inner ear, the labyrinth,
Mm.
that's what triggers those kind of classic symptoms, yeah.
Precisely. The notes list the big three: vertigo, hearing loss, imbalance.
Okay, vertigo, hearing loss, imbalance. And why those three specifically?
Well, the notes explain it well. The labyrinth, it's not just one simple part. It's this complex structure housing the sensory bits for both balance, things like the utricle, saccule, semicircular canals, and hearing, which is the cochlea.
Oh, okay. So if that whole area gets inflamed.
Exactly. If it gets inflamed or damaged by the virus, it messes up both balance and hearing signals, hence the symptoms.
Got it. Now, here's something the notes really seem to emphasize, and it seems super important for revision. How do we tell this apart from vestibular neuritis? They sound pretty similar.
They do sound similar, and you're right, the notes flag this as crucial. It's a really common point of confusion.
So what's the key difference based on this material?
Okay, so it boils down to what exactly is inflamed. Your notes say vestibular neuritis is inflammation of only the vestibular nerve.
The balance nerve, basically.
The balance nerve, yes. It carries balance signals, but crucially, it doesn't involve the hearing parts, like the cochlea.
Okay, so vestibular neuritis, balance problems only, no hearing loss.
Correct. Now, labyrinthitis, according to these notes, involves inflammation that affects both the vestibular system and the cochlea, or the auditory nerve pathways within the labyrinth.
Ah, okay. So labyrinthitis hits both balance and hearing. That hearing loss is the absolute giveaway.
That's the key differentiator mentioned right here in your source. Labyrinthitis, balance plus hearing issues. Vestibular neuritis, balance issues only. Nail that distinction.
Definitely a high yield point. Okay, let's step back slightly. Etiology, the causes. What viruses are we actually talking about here?
Well, the notes state the primary cause is, unsurprisingly, viral infections.
Anything specific? Or just general viruses?
Seems like it's often linked to the sort of common viruses we all get. Think respiratory viruses.
Like flu, or just a bad cold?
Exactly. Influenza, common cold viruses, things like that are often the culprits mentioned here.
Huh. So how does a cold virus end up causing chaos in your inner ear?
Good question. The notes suggest two main routes. Either it travels through the bloodstream to get there, or, maybe less often, it directly invades the inner ear tissues.
Okay. And the notes also mention bacterial labyrinthitis briefly.
They do, yeah, as something to be aware of, but they really stress that the viral form is much, much more common.
Right. Good to know. What about risk factors? Does everyone who gets a cold risk getting this?
Not necessarily, but the notes list a few things that might increase the risk. A big one is having a recent viral upper respiratory tract infection.
So it often follows a cold or flu.
Yeah.
Makes sense.
Yeah. Also, having a compromised immune system is mentioned, and just, general exposure to people with viral infections. Standard stuff for infectious causes.
Okay. Let's dig into the pathophysiology. How does the virus actually do the damage? What's the chain reaction here described in the notes?
Right, so the notes lay it out pretty clearly. Step 1, the virus gets into the inner ear. Step 2, your body reacts, right? It triggers an inflammatory response to fight the virus.
Okay, inflammation. But that's the problem here.
Exactly. That inflammation causes swelling and just general dysfunction within the labyrinth itself.
And because the labyrinth controls balance and hearing?
That swelling and dysfunction directly mess up how the vestibular system, balance, and the auditory hearing work.
Leading straight to the symptoms.
Leading straight to the vertigo, the imbalance, the hearing loss. It's a clear pathway. Virus inflammation, labyrinth dysfunction, symptoms.
Virus inflammation, dysfunction, symptoms. Got it. Good way to frame it. Now, differential diagnosis, always important. Why is it so critical to think about other things it could be?
Well, like the notes point out, symptoms like vertigo and dizziness are pretty nonspecific, aren't they? They can be caused by lots of different things.
True.
So you absolutely have to consider other possibilities, especially ones that might be more serious or need totally different treatment. You don't want to just assume it's viral labyrinthitis and miss something else.
Good point. What are the main lookalikes the note suggests keeping on the differential list?
Okay, so the list includes bacterial labyrinthitis, less common, potentially more serious. Meniere's disease is in there.
Yeah, that also causes vertigo and hearing issues, right?
It does, but typically in a different pattern, often more episodic. Then, of course, vestibular neuritis, which we've covered.
The one without hearing loss.
Exactly. And then just other sort of general inner ear disorders or even problems originating in the brain, the central nervous system, that could mimic the symptoms. It's about ruling things out.
Makes sense. What about epidemiology? How common is this condition based on the notes?
The notes say it's relatively common overall in places like the UK, although getting precise numbers is apparently tricky.
And who gets it? Any specific group?
Seems like it can affect people of all ages, really. But the material does mention an average age of presentation often being between 40 and 70 years old.
Interesting. Maybe just more exposure to those common viruses over time. Okay, let's get into the clinical presentation. What does it actually look like when someone has this?
Okay, the notes really highlight the sudden onset. It hits you quickly.
Right. And the key symptoms again.
That core group. Intense vertigo, like the room is spinning, significant dizziness, and real difficulty with balance.
And the hearing loss.
Yes, associated hearing loss. The notes specify it's often unilateral, so just in one ear, and the severity can vary quite a lot.
Okay. And I guess with that much vertigo, things like nausea and vomiting are pretty common.
Oh yeah, definitely. The notes list nausea and vomiting, plus tinnitus, that ringing or buzzing sound in the affected ear.
And often linked to that recent cold or flu we talked about.
Yes, that's a big clue in the history, often a prior or even ongoing upper respiratory tract infection. The URTI link is strong.
Now, the physical signs. This sounds like prime exam material. What specific things should you look for on examination, according to these notes?
Absolutely high yield, this bit. First up, nystagmus.
The involuntary eye movements.
Exactly. In viral labyrinthitis, the notes say you're looking for spontaneous, unidirectional, horizontal nystagmus. So the eyes are flicking side to side in one direction.
And the direction it flicks is important, right?
Crucial. The notes are very specific. It typically beats towards the unaffected side.
Towards the good ear. Why is that?
Sort of like the healthy side is overcompensating or pulling harder, signal-wise. That directionality is a key sign to remember.
Okay, nystagmus beats away from the bad ear towards the good ear. Got it. What else?
You'd want to confirm the hearing loss, maybe with simple bedside tests like Rins and Weber initially. The notes also mention checking the vestibulo-ocular reflex, or VOR. That's what keeps your eyes stable when your head moves.
How do you test that?
With something called the head impulse test. If it's abnormal, it suggests a problem with that reflex, pointing towards an inner ear issue like labyrinthitis.
Okay. And the imbalance, how does that show up when they try to walk?
You'll likely see gait disturbance. They'll be unsteady. And importantly, the notes say they may tend to fall towards the affected side.
Okay. So let's lock that down as a memory tip from the source. Nystagmus beats towards the unaffected side, but the patient falls towards the affected side.
Exactly. Those opposing directions are classic and definitely worth remembering.
And based on all this, the history, the symptoms, these specific signs, the diagnosis itself is usually pretty clear.
Yeah, the notes really emphasize that it's primarily a clinical diagnosis. Putting together the story and the examination findings is usually enough.
Right. So, investigations. If it's mainly clinical, when do you need extra tests?
Good question. The notes clarify that while you diagnose it clinically most of the time, investigations are sometimes needed.
For what purpose, mainly?
Usually either to confirm the extent of the hearing or balance problem, or, perhaps more importantly, to rule out those other conditions we talked about in the differential diagnosis.
Ruling out the scary stuff, or things that need different management. What tests are actually mentioned?
Okay, so audiometry is listed. That's a formal hearing test, useful to quantify the hearing loss.
Makes sense.
Also, vestibular function tests, which specifically assess the balance system's function.
Right.
And imaging, like an MRI scan, is mentioned too. But the notes stress this is mainly to exclude other causes like a stroke or a tumor mimicking the symptoms, or to look for complications, not usually as a first-line test for a typical case.
Okay, so tests are more for backup or if things aren't straightforward. Got it. Let's move to management. How do we actually treat this, according to the notes? What are the goals?
The main aims are pretty simple, really. Relieve those quite debilitating symptoms, especially the vertigo and nausea, and just support the patient's recovery.
And what are the main approaches listed in the notes?
The core strategies involve medications, primarily for symptom control in the acute phase. Then, vestibular rehabilitation exercises play a big role later on.
To help the brain adapt.
Exactly, to help the brain compensate for the damage and improve balance over time. And maybe some general lifestyle advice, too.
Any specific drugs mentioned for the symptoms?
Yeah, the notes give examples like prochlorperazine, which is an anti-sickness drug that also helps with dizziness, or antihistamines, which can also have anti-dizzy effects.
Okay. And the notes also mentioned it's often self-limiting.
They do. That's the encouraging part. Viral labyrinthitis often tends to get better by itself over time, though treatment helps manage the rough initial period.
Which leads nicely into prognosis. What's the general outlook?
Generally favorable, according to the source material. Most people experience gradual improvement in their symptoms.
How long does that usually take?
It varies. Could be several months for things to really settle down, but improvement is the typical path.
Is it always a full recovery, though? Back to 100%?
Not necessarily. The notes make a point of mentioning that persistent hearing loss or some level of residual dizziness can sometimes remain even after the main acute episode resolves.
Okay. So while most do well, some might have lingering issues.
That's the picture painted here, yes.
And that ties into complications. Are they common?
Thankfully, the notes state complications are rare.
Phew. But what are the potential rare complications listed?
Okay. The source mentions chronic or recurrent vertigo, basically. The dizziness doesn't go away or keeps coming back.
Right.
Long-term hearing loss, as we just touched upon. And interestingly, psychological distress.
Psychological distress from an ear infection. How so?
Well, think about it. If you have persistent vertigo or you can't balance properly or you've lost hearing, it can massively impact your life, can't it?
Yeah, I guess daily activities, work, driving.
Exactly. Your mobility, your independence, your ability to socialize, it can be incredibly disruptive and frightening. So the notes mention that this can understandably lead to significant anxiety, depression, or just feeling really isolated and low. It makes sense when you consider the impact.
That's a really important point. It's not just the physical symptoms.
Definitely not. And the notes add that getting proper treatment and good management might help reduce the risk of these longer-term issues.
It really highlights how interconnected everything is: physical health, our senses, our mental state.
Absolutely. A vital thing to remember.
It is. So as we wrap up this deep dive into your notes on viral labyrinthitis, thinking about those potential complications, especially the psychological impact, even from something often self-limiting, here's something for you, the listener, to mull over. How does a condition like viral labyrinthitis, seemingly localized to the inner ear, really underscore the deep connection between our physical health, our sensory input, like hearing and balance, our ability to move freely, and our overall mental and emotional well-being? It's a reminder that treating the patient means looking at the whole picture.
A really important perspective to carry forward, especially when thinking about ongoing care.
Definitely. Well, we've thoroughly unpacked your notes here: definition, causes, those key symptoms and signs.
Diagnosis, management, prognosis, complications, the works. Hopefully breaking it down like this and really focusing on those key differences, like with vestibular neuritis and the specific exam findings.
Yeah, like the nystagmus direction versus the falling direction.
Exactly. Hopefully that makes it all a bit clearer and easier to lock down for your revision.
We hope this deep dive was helpful. Thanks for sharing your notes with us. Definitely revisit those key points: the differentials, the physical signs they're often tested.
And if you're looking for more resources, particularly if you're revising for the MSRA, don't forget to check out passthemsra.com.
And there's also freemsra.com for, well, free resources too.
Always worth a look.
Absolutely. Until next time, keep digging into those details.